The Philippine Nurses Association of Nevada now brings you FILIPINARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Power.
Well, hello to all of you FILIPINARS listeners and followers. I hope you had a good and a happy 4th of July celebration. Thank you for joining us today. And as you know, FILIPINARS is brought to you as a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with our favorite radio station, PHLV Radio. And speaking of the PNANV, before we start our program, I would like to let you know that the PNANV is holding a summer seminar on July 29th. The theme for the seminar is Cultivating and Nurturing Civility in Healthcare. It is a very timely and appropriate theme. The seminar is free of charge for PNANV members and students, and only $25 for the non-members. RNs will earn 6 CEUs, or continuing education credit. So the seminar will be held at the Optum Healthcare Chairman's Auditorium in Tenaya Way. Please look at the flyer on your screen, and you can scan the QR code to get to the link to register, or you can visit our website at pnanv.org. Thank you so much, and we hope to see you there. Okay, so let's get to our program. So earlier this year, we talked about FAPCOR, the Nayon Project that got organized here in Nevada. And as a reminder to you, FAPCOR, which is spelled FAPCOR, means the Filipino-American Patient-Centered Outcomes Research. The goal of the project was to create a nationwide infrastructure that would, and through research and collaboration with the community, it would benefit the Filipino-American population. The Nevada group has been working tirelessly on this Nayon project, so today we are going to hear about a new collaboration towards that goal, specifically on diabetes self-management. So here to talk to us today about this topic are Dr. Elizabeth Fildes, one of the Nevada Nayon academic research collaborators, and 3 of the educators from Dignity Health. So we have here Mark Domingo, Casey Lyn Domingo, and Jemaima Tagayuna. Dr. Fildes needs no introduction. She is a Filipino-American nurse leader in the community who demonstrates a lot of passion to and commitment into the community and education. She is one of the recent Tanglao Awards awardees of the Filipinars Association with regards to global involvement. So congratulations and welcome again.
Thank you, Doris.
You're welcome. And okay, so we have to let the Dignity Health educators introduce themselves. First, we have Mr. Mark Domingo. Mark is the Community Health Manager for Dignity Health Neighborhood Hospital Wellness Centers. Mark, can you tell us a little bit about yourself?
Yes, so I'm 100% Filipino. I am a full Pinoy. I'm very excited to be here today to have some really great dialogue with some of our programs within Dignity Health, specifically diabetes, because we know that is something that is prevalent within our Filipino communities.
Right.
And we could definitely provide that support and guidance with education. I was born in the Philippines and moved here when I was 10 years old, and from there really develop a sense of community and wanted to do work in our public health setting. And I went through UNLV, Healthcare Administration and Policy School of, over there, and I was very excited to discover Dignity Health and what they offer, and started developing programs and seeing how we can further our mission by serving more of our population. So
very good.
A little bit about myself.
Very good. Well, thank you. And so our next guest is Ms. Casey Lyn Domingo, who is the program manager for disease management in Dignity Health. Before I do this, are you two related? Because you have both last name Domingo.
Maybe in their family tree, but no relations here.
No relations here. Okay. All right. Sorry to take the spotlight out of you.
No
Casey,
worries.
Casey, can you tell us a little bit about yourself?
Yes, so I am also 100% Filipino, but I was born in Guam, and then I came here when I was about 8 years old. I also am a UNLV alumni myself. I graduated with my undergrad at UNLV with my healthcare admin, and I am currently a grad student right now. I'm graduating next year with my master's in healthcare admin. So that's a little bit about me.
Nice. Very good. Very good. All right. And last but not least is Miss Jemaima. She is a community health educator for Dignity Health, right?
Yes. Thank
Okay.
you so much, Doris, for the introduction. I am a community health educator within Dignity Health, St. Rose Dominican. I also am a running rebel myself. I have my undergrad in public health at UNLV, soon to pursue my master's in public health as well. We're so grateful to have this opportunity today to talk about all of our various programs to really help empower our Filipino community and extend our resources to our fellow kababayans here in Nevada.
All right.
All
Yeah,
right.
all right. Well, this is exciting. This is exciting. So, Dr. Files, can you give us a reminder of the goals of FAPCOR, the Nayon Project, and the activities in the Nevada Network?
So I want to focus on what we've done so far, and it's very exciting. Our group, the Nayon, has done strategic planning. And the main outcome of that is that we need to do primary, secondary, and tertiary prevention of chronic diseases that have been brought to us through our focus groups by the attendees of this focus groups. And so what came out from that is that our Filipino-American community here in Las Vegas want chronic disease management education, specifically diabetes, cardiovascular disease. The other thing that came up was addressing mental health disorders among our kababayans. So I was so thrilled to find Dignity Health, Community Health, and a big plus is that all of these young people with us now are Filipino-Americans.
That is so awesome. That's what I was going to ask you is, how did y'all get involved? So
I was just looking for resources in a community because we identified that this is what our Filipino-Americans here in Las Vegas need. And I thought, okay, these programs must already exist. And lo and behold, I found Mark, right?
awesome.
And then visited Mark, and everyone is Filipino in his group. So this is so exciting. So, Taurus, when you do God's work, everything just falls into place.
Exactly.
And so how beautiful that we have this young people with us, very young people with us, to help us meet the needs of our Filipino Americans here in Las Vegas. So very, very exciting.
These young people are our future, of course.
Yes, very much so.
And so I forgot to ask you, which locations do you all work out of? Mark, you work out of which location?
The wellness centers. So I have
wellness
an
center.
opportunity to oversight and provide leadership within our neighborhood hospital wellness centers. We have 4 different locations throughout the valley, located at different areas. So we have one at Blue Diamond and Decatur. We have one at West Flamingo and 215. We have one at Craig and North Las Vegas, right at MLK.
I know where that.
And then our 4th one that we're opening up in several months, we're very excited, is Sahara and Decatur.
Oh, yeah, I passed by that okay, when is this going to open?
So it's already a full functioning ER, but the 2nd level where the wellness center will be at is not yet built. So that's something that we're working on right now as part of our project.
Okay, great. And this little ones they're called your neighborhood hospitals, right?
Yes.
Okay, great. That's awesome.
Beautiful.
Yeah, and Casey, where do you? Oh, yeah.
Doris,
go ahead.
I just wanted to ask Mark, is a virtual attendance always an option in your program?
Yeah, so that's something COVID has definitely prompted us to do, is we understand during sheltering in place, that we needed to have valuable programs like the ones that we offer at Community
Right.
Health with chronic disease prevention, socializations, to be on the virtual platform. So a lot of our programs that we offer, from exercise classes to cooking demos to
Ooh,
chronic
love
disease
that.
programs, are also offered virtual. So people
Virtual.
could tune in from home, and they could also come in person if they feel comfortable.
Very good, very good, very good, very good. And Casey, where do you work out of?
Yes, so I am based off of our Green Valley Community Wellness Center. And then I also am at where Jemaima is, West Flamingo.
You are at West Flamingo?
Yes, I am actually, aside from being a community health educator, I'm also the coordinator for our West Flamingo Wellness Center. Mark and I like to call it my side gig. We love being in the neighborhood hospitals because they were strategically placed in areas that did not have an emergency room within a 6-mile radius. So as Mark mentioned, the first floor is a full-on emergency room, and then the second floor we will provide our wraparound services. We have a primary care medical group, physical therapy, and then of course our wellness centers where we are able to provide fitness classes, nutrition classes, hopefully chronic disease classes in the future as well for Filipino communities.
I'm so glad you cleared that up, because I don't think a lot of people know exactly what these sites are, apart from the different hospitals that you have, which is Siena, San Martin, and
Rose de Lima.
and Rose de Lima, right?
Yes.
So, this is just wonderful information. Okay, so I'm going to ask you several questions, and feel free to tag team whichever. Okay, so can you tell me about the Dignity Health Diabetes Self-Management Program? Describe the mission, the goals, and the goals of the program.
Sure. So the Diabetes Self-Management Program, this is a program that we were able to take here to Dignity Health. It is originated from Stanford University. So it's an evidence-based program proven to really increase self-efficacy for the participants, decrease ER visits, and also improve when it comes to overall health interventions. A lot of the programs that we offer are evidence-based, and something that we do believe in, just because we understand that if you deliver the program a certain way, if the participants process through the program, they're able to have similar great outcomes.
Yes.
So that's something that we definitely specialize on. The Diabetes Self-Management Program focuses on not just the diabetes component, but just an overall healthy lifestyle. I know Jemaima and Casey will be diving on later on the different components and the contents, but it's a really great program to really get involved in when it comes to self-managing your diabetes and gaining that confidence. I feel like a lot of our Filipino communities could really use some of the tools and the strategies that the program can provide into managing just not their diabetes, but just a healthy lifestyle overall.
Right, because that is a huge challenge with the Filipino diet, right?
Yes.
Like me, I'm borderline now, so I might come to your program.
All the yummy
Come
ube
on
leche
over.
flan.
Oh,
Yeah.
all of that
all
stuff.
the
Oh
yummy
my Lord.
goodness.
Okay, well, thanks, Mike. So, do you have any funding for this program?
Yes, we do. We have a long-standing relationship with our funders. A couple of them are Comagine Health. We also work with the Department of Chronic Disease Prevention with the state. We also have funding that is based off of the population 60 and older, the ADSD grant. I am so proud to say this, but almost all our programs that we do have for chronic disease are all grant funded. So we are
Great.
able to provide this complimentary to the community without any cost.
That is so awesome. That is so awesome. So, is this program, and I know you have other programs, but this particular program, is it geared specifically for Filipinos or Filipino-American population, or is it offered to other people as well? If so, why?
Yes, so we've collaborated with multiple organizations previously, and I think this collaboration with Dr. Fildes and Nayon will really bring forth diabetes self-management geared towards the Filipino community. I feel like representation matters.
Yes.
Having
Yes.
Filipino educators like Jemaima, Casey, myself, and Dr. Fildes really is important, and for our participants to see that they have representation and they feel seen, that a lot of the cultural nuances that we have, that we are proud of as Filipinos, are being talked about.
Yes.
And then that's something that the dialogue will naturally happens within our specific diabetes self-management programs.
Yes, and
So-
as Mark
yes.
mentioned, Doris, we in the past have partnered with Station Casinos, Volunteers in Medicine of Southern Nevada, other federally qualified health centers, and also with our Black community. And we're really grateful for FAPCOR to be able to bridge this relationship into us serving our Filipino members and really providing self-efficiency and managing their conditions. It goes just above diabetes management, but just overall quality of life improvement and health outcomes.
Yes, yes.
So, Jemaima, with your collaboration with Station Casinos and Volunteers of Medicine, do you do programs in their properties?
Yes,
too?
we do.
Wonderful.
yes.
That's awesome. We got to talk about that cooking stuff with.
Yeah,
absolutely. Let's do an episode on that one.
Absolutely. I think it would be so awesome.
I think it would be so awesome.
Right.
Okay, so I guess this, when Dr. Files approached y'all, it was a no-brainer, right? You just had to
No-brainer.
come over.
Yeah, and then there's certainly a lot of alignment with Nayon. We collaborate with the Southern Nevada Health District when it comes to our community health needs assessment.
Very
So
good.
through that, it determines our priority areas for community health within Dignity Health for the next 3 years. And the number one top priority was chronic disease.
Yes.
So there's a perfect
Yes.
marriage, I think, when we both met. We had a lot of synergy already, and we are so excited to collaborate and see what else we could do with our Filipino-American community and Filipino community here.
Very good. We are really excited about this. So, so how will you organize and secure participation for your educational programs?
Yeah, so
Do you wanna
our
answer that?
yeah,
Yeah.
our participants, now that we're establishing this relationship with the Nayon group, in the past we have built referral systems with our partners such as Station Casinos, Volunteers in Medicine of Southern Nevada. With our medical centers, we love to have a referral system and a referral pad. We know that our providers are busy seeing one patient to the next. We have a quick referral pad where they can just cross off the needs of their patients, and
like
one
a
of them is
checklist,
chronic
yeah.
disease prevention or education for self-management. And we hope to further establish that with our Nayon group, with the Filipino providers, nurses, and other educators that we'll be in touch with, so that we're able to offer this class to the community, not only at our centers, but if there are other places where our Filipino community meets, we will go where they are. We are a traveling partnership
Always
here.
on the go.
Always on the
That's
go.
good. That's
Wonderful. The other
awesome.
thing I wanted to ask is, okay, with this referral, right? This referral is sent to you. What is the next step on your part?
Yes.
You reach out to this patient?
Yes, definitely. So once we receive the referral, securely, of course, I will either call the participants myself, explain our programs and what upcoming dates we have, or send an email, whichever method of communication they prefer, just to have that warm handoff and feeling welcome. You know, Filipinos, once we meet, it feels like family. So
Yeah.
I will be the main point of contact with our participants to take them to the next step. So let's enroll you into this program and do a needs assessment as well. Outside of diabetes management and chronic disease management, what other services are we able to offer you? Join our nutrition classes, join our fitness classes. Here are the other free services that we are able to offer, and we don't ask for your insurance because we are completely grant funded for our programs, at least.
Isn't that
That
wonderful?
is wonderful. That is wonderful. That is wonderful. So, what are the specific topics that you educate your participants on with regards to diabetes?
Okay, so the topics for this class is just beyond diabetes, right? It just
Yes.
you can be living with diabetes just like a normal life. So a lot of the topics just based off of the workshop is more of like healthy eating, communication skills, stress management, because I know we all deal with that on a daily basis, and overall like activities and showing them and giving them tips on how to accomplish that beyond just going to the gym. There's more than just that.
Yeah, and to add on to what Casey is saying, this class is just more than a class that you have to attend. It's not just a lecture. We want to build a support group for our kababayans here. I know your doctor is going to lecture you about your medications and, you know, what your labs are. We are here to educate you to say that, you know, diabetes is not just a diagnosis. It's not a death sentence. You can live a healthy, happy life through healthy eating.
Yes.
Fitness, we make it fun. You know, it's not just going to the gym, as Casey said. Join your loved ones and your family. And one of the topics that we really want to touch on is mental health and communication. It's one of the toolbox that we use in our self-management skills. You know, as Filipinos, we are very community-oriented, so we always take care of others before ourselves. So with the toolbox for our management classes, we talk about, these are my needs, and this is how I would like for you to help me out. This is how I feel supported. This is how I feel loved. This is how you are able to help me out. Not just with, you know, your husband, wife, children, but everyone else in your support group as well. Just to feel that cultural nuance of, this is our Filipino community. We have similar upbringings.
Yes.
And let's continue to support one another.
Okay.
That's beautiful.
Yeah, go
With
ahead.
communication skills, I think that's something that Filipinos are always, you know, I think it's important for us to communicate our feelings, our values, and our stories. A lot of the program activities that we have within the diabetes self-management are all group activities. So it really relies on some of the history and some of the things people have experienced to really share and also put value in when it comes to empowering each other. So there's a lot of empowerment that our diabetes self-management program can really bring to our Filipino community.
Yeah, that's really good. Communication is really an excellent part of that. On account that, well, you know how Filipinos are, they tend to bottle things up. And they don't want anybody to know what's going on with them. And so instead of seeking, you know, the help, you know, they just bottle it up. But that's really great. That's good. What about in terms of, like, say, if they can't come to your program, do you have, like, transportation assistance or anything like that?
That is certainly something we can arrange. We have community collaboration, so we work with other partners that could provide transportation services. So potentially, if they are in need to get into one of our wellness centers, we can connect one of our partners to provide free transportation from Lyft or Uber rides or things like that. And things could be virtual too, so we can offer it in Zoom, and they could connect from home if they're comfortable in doing that.
If they're comfortable doing that. Yeah, and that Zoom is also good. But there are also a lot of elderly people who don't have the internet or don't know how to use the internet, so that could be a challenge as well. So,
Yes.
okay, anything else for?
I do. Just to
Yes.
touch up, I know we talk about food. It's our
Yes.
love language. And as Filipinos, we love our fiesta foods and, you know, pork and all of the yummy desserts. And just to touch up on our diabetes self-management program is that we are not telling you to completely get rid of the food that you love. That would not be a happy life. We talk about modifying what can we do with our cooking and just reducing just a little bit of the patis and maybe low sodium tuyo. I know we love our fiesta foods, but I think a lot of our cultural dishes are actually very healthy. We have a lot of gulay that we can incorporate.
Correct.
Just about modifying. So
Let's
lives
do
different
a
lifestyles.
cooking thing on that. The modification for. Let's do that.
Yes, wonderful.
That's wonderful. Maybe we can involve the station casinos here.
That would be fabulous.
Yeah, okay. All right, well, let's talk later.
A lot of good ideas today.
Yes, that's good.
Absolutely,
I
yes.
am really interested. So you have 7 locations where you conduct these classes, and we'll put that up on screen. And you have, can you mention those places again?
Yes, so
Here.
we have our 4 micro hospitals, or neighborhood hospitals that has wellness centers. So again, we have our West Flamingo location at West Flamingo and 215. We have Blue Diamond in Decatur. We have MLK and Craig up in North Las Vegas. Our Sahara and Decatur location will be opening up later this year, so we're excited for that. But our 3 other locations are located adjacent from our campuses, for our main campuses.
okay.
So at Siena, we have one right across the street at Paseo Verde and St. Rose. We have one at Rose de Lima, right inside the hospital, and then we have one at San Martin as well, across the hospital as well.
Oh, very good. Very
So
good.
we do have a variety of different locations, and all of those locations are very similar. A lot of the programming that's offered in one is also offered at all. So there's a lot of
Okay.
different variety of programs participants the Filipino-American communities can really utilize.
So you schedule these classes, right? So
We do.
you have a schedule for like a month or something, and then you go from there. Yeah, very good. Very good.
I love the one-on-one connection
Yes.
that Jemaima talked about. You know, once the referral gets to them, then she reaches that to the patient, which is so wonderful. The research, of course, is showing warm handoffs are the most wonderful way to reach them. So approximately, for example, you got the referral this last Friday, yesterday. When do you get to them?
I usually do a 24-hour wraparound and getting back to the participants, unless we're out of office, which is rare. We do love our jobs quite a bit, sometimes a little too much. Within 24 to 48 hours, as soon as I receive the referral, I will definitely make time within 24 hours to get back to the patients that are interested of our services. Because if we go way too long, then they don't feel welcomed, and we just want to make sure that they feel seen and saying, I am here to help take care of you.
Totoo.
Good.
Alright. The
That's true.
sooner,
That's
the
true.
better. So ilang beses, how many times
How many
Yeah.
times?
do you
So-
attempt to
Yes.
reach them?
Yeah, within our company, we have a rule of 3 attempts. So
Okay.
after the third voicemail, if they do not get back to us, then we do not contact them back. If we're not able to leave a voicemail, then I would personally do 4 or 5 attempts, but 3 is usually our sweet spot of attempting our participants.
And then how do the provider who referred to you know about the outcomes of the referral?
Yes, definitely. So Mark is working on providing feedback to where our
very
patients
important.
are. We have established with our federally qualified health centers a web-based referral system called Community eConnect that is funded by our partners at the Department of Behavioral Health.
Nice.
So they send referrals virtually, and then we are able to send back a feedback report of, yes, this patient got enrolled into the program. They have attended X amount of sessions. They've completed, or there's an option to say they're no longer interested in our services. Yes.
And that's good for statistics for
Yes,
the
yes.
Nayon
And
Project
it's
as well.
so important to
It's
the
important,
people
right.
who are sending you patients, because then it reinforces to them your commitment and what a
Yes.
wonderful service this
Yeah.
is.
Are you in touch with the Filipino associations here in Las Vegas?
Not yet. So
All
that's
right.
definitely
So this
a
is
connection
our-
We're
that
gonna
we would
get
love.
you there.
Right.
So
Okay.
we have an association called NAFA. It's the National Association of Filipino-American here in Nevada, and they have a youth segment as well. And under them, it's sort of kind of like not an umbrella, but there are a lot of organizations, Filipino organizations that belong. So let me introduce you to them.
Would be
Jackie, you
amazing.
listening to this? Jackie
Jackie.
De Hoya is the current president of NAFA Nevada, and so I'll put you in touch with them.
That would be
And
wonderful.
you will reach a lot more of, those, the Filipino community here.
And
would be
Jackie
amazing.
is, of course, in our stakeholders advisory
Yes,
council.
correct.
Yes,
That's
so
right.
That's the
So,
connection.
yeah, let's get her in.
Right.
Let's get
So
her in.
hopefully at the next meeting of NAPA, we could get this guys there.
Yes,
So
let me-
then people get excited about that.
That's good. Yeah, I'm gonna have to. Yeah, I'll get in touch with her. Don't worry.
Thank you. Thank
Sure,
you.
sure.
At the next meeting,
At the
Doris.
next meeting. At the
And
next meeting.
also, hopefully, at the July 29th meeting.
July
they could
29th
set up-
meeting.
When is your conference?
July 29th that's when the
Civility
seminar is.
Summit.
July 29th. I'll send you some information and maybe you can have a table there. Unfortunately, there's a
Right,
sponsorship thingy.
right.
So, but you guys are funded, so I think you'll be fine.
I think, yeah.
I think this is a very special project, that you guys have.
And I hope
know,
during
created.
your break,
Yeah.
you can have them speak for 5 to 10 minutes
Well,
about
well, yeah.
what they are offering.
Correct.
Thank you.
They
Using
have,
my connection.
if they if they
There's so
have
much
a
synergy.
table,
Yes.
then we have an opportunity breaks during the seminar wherein the participants go to each and every different table just to find out what it's all about. So
We will
Thank
be there.
you.
You're-
Thank
you're
you.
welcome.
Do you
Sure.
charge for the table or no? It's free?
We'll
it
talk
free?
later. Oh no.
We're part of the Philippine Nurses Association.
I know. Well, we'll have to talk to Lisa on that one. No, I'm just kidding.
Okay.
So, but anyway.
Very good. Thank you.
So, if there is an interested participant that wants to join your program, how will they go about joining it without the referral, of course?
Definitely. We welcome self-referrals. If somebody is interested, please feel free to call us. The main line to call will be mine at the West Flamingo location. So please call me, Jemaima, at 702-620-7800.
7800. I think we have the numbers on the screen there of the different sites. So you are 702 West Flamingo, you said?
Yes.
Okay, so 702-620-7800. Okay, all right. Very good. Very good. Well, this was really fun. So,
know.
yeah.
I love this.
So,
Thank you.
what is your message to the community with regards to your program and overall chronic diseases? Let's start with you, Mark.
For all the kababayans out there, I think it's important for us to really take step when it comes to taking care of ourselves. I think health is wealth. I always hear that all around. And being able to find that support from others. I feel like it's important to see representation and to be seen out there when it comes to our culture and our heritage, and
Right.
be able to celebrate that and incorporate that within helping our managing our chronic conditions. Our free services is complementary to the community. So that's one thing that we're always talking about, is creating awareness about our wellness centers, because we do
Yes.
exist.
Yes.
And then you guys could fully utilize it and really see the benefits, see the impact on your health, and keep taking our programs and services because it's complimentary. It's free for the community.
That is just wonderful. Thank you, Mark. What about you, Casey? What is your message to the community?
So my message is that just reach out to us. We want to help. We want to be your support system. We want to provide you with anything and everything we can in our power. And it's most complimentary, actually. I'm so excited about that part.
Libre po. Libre.
Yes, libre.
Okay, and Jemaima?
As a Filipino-American, we are just so grateful to be able to use our platform to take care of our Filipino community. I think we're a Filipino familia here in Las Vegas, and as the doors open, we just want to service as many of our community members as we can. And as we mentioned earlier, in order to take care of others, we have to take care of ourselves first. And in order to take care of others, we have to live a healthy, happy lifestyle. And we are here to support you by any means, whatever that may be, with all of our services.
Well, thank you so much for that. And of course, Dr. Files,
The one
I
and
call her
only.
Elizabeth. We've been friends forever. So-
Absolutely. Yes, absolutely. So my message is, wag nang maghintay. Tumawag kaagad kay Jemaima at may tulong na.
May tulong na darating sa inyo.
Here we are.
Okay. All right. Well, thank you so very much on behalf of the PNANV, on behalf of FAPCOR Nayon Nevada, and of course, the Nevada Network, I should say, and FILIPINARS. I'd like to thank you all for coming to the program today. We really appreciate it. We're excited to show, the resources, especially from young people like you. That's really great. So thank you again.
Thank you for
Thank
having
you
us.
for having us.
Yes,
That'd be
yes,
so
yes.
helpful.
And to our listeners, we leave you with this. Many Filipino Americans suffer from healthcare issues, and among those healthcare issues are diabetes, cardiovascular disease, and mental health. Today, we were able to highlight diabetes management and where to get assistance for self-management. The Diabetes Self-Management Program of Dignity Health has the recognition of ADA, which is the American Diabetes Association. The program empowers the participants to better manage their diabetes while learning different tools to live a healthier and happier life. They will learn healthy eating, dealing with stress, goal setting, positive thinking, and developing support systems, and so much more. And so thank you for that. And we are also thanking FAPCOR Nayon Project for helping our Filipino-American population to deal with the chronic health issues and needs through research and community collaboration. Thank you again to our special guest today. We appreciate all that you do. And thank you to our listeners and followers. Thank you for giving us the privilege of your time. This is Doris Bauer, your FILIPINARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FILIPINARS, news and features about the Filipino-American nursing community and beyond.